Welcome to this presentation of the College of Licensed Practical Nurses of Alberta 2021 Annual Report. The Health Professions Act authorizes the CLPNA to regulate the LPN profession. The Council of the CLPNA is responsible for the governance of the CLPNA and oversight of its management. Changes to the Health Statutes Amendment Act resulted in two significant areas of legislative changes. The first was Bill 30, requiring all health profession regulatory colleges in Alberta to increase the number of public member representation on their councils, hearing tribunals, and complaint review committees. In 2021, the CLPNA Council underwent significant change with increasing its size, increase in public members, and changes to bylaws to comply with Bill 30. The second legislative change is Bill 46. Bill 46 introduces the future regulation of healthcare aides as a separate profession within the CLPNA, along with the separation of regulatory and professional association roles. While the CLPNA did not function as a professional association for LPNs, the passing of Bill 46 has accelerated the CLPNA's strategic plan to focus on its regulatory functions. In 2021, the CLPNA engaged in the necessary work to enable this strategic focus, including reviewing its professional regulation, bylaws, standards of practice, program approvals, and operational policies. We are pleased to inform that registration numbers continued to rise in 2021, with a 6.2% growth, ending the year with a total of 18,750 LPN registrants. A priority for registration in 2021 was to continue to offer clear, fair, and consistent registration processes. Moving registration applications online improved access for LPNs seeking reinstatement, those from out of province, internationally educated nurses, and for Alberta new graduates. Passing the Canadian Practical Nurse Registration Examination is the final step required for those on a provisional register to obtain full registration with the CLPNA. The Alberta annual average for Canadian first-time writers was 90%. The national average for Canadian first-time writers was 85%. Internationally educated nurses who wrote the CPNRE through Alberta had an 84% average pass rate. As the pandemic extended into 2021, the registration process was continuously reviewed to find ways to streamline applications for LPNs. Some of these initiatives included developing a more efficient approach to courtesy registration, including working with organizations like Alberta Health Services, the Red Cross, and many travel nursing agencies to ensure an expedited registration process. The Conduct Department at the CLPNA receives, investigates, manages, and resolves complaints made against regulated members. Public safety is the priority, and we are committed to efficiency and transparency in all conduct processes. In 2021, the CLPNA responded to complaints on average within 1.5 business days. Complaints were handled within the timeliness specified by the HPA and the procedures outlined by the CLPNA. During the COVID-19 pandemic, investigations were managed remotely by phone or video conference to align with Alberta Health's COVID-19 guidelines. As of 2019, all hearing decisions are published and available to the public on the CLPNA website in alignment with legislative requirements. Licensed practical nurses gain and maintain competence through education over the lifespan of their careers. Continuing competence is essential in meeting the demands of evolving practice environments and patient needs, and the CLPNA's Continuing Competence Program provides LPNs with a framework for assessing their individual competence. LPNs demonstrate their commitment to continuing competence through the CLPNA's Continuing Competence Program, an annual review process in which LPNs assess, monitor, and reflect on their nursing practice. The CLPNA provides ongoing education to support the continuing competence of LPNs. In 2021, this included 39 webinars covering a variety of topics, with fitness to practice and mental health and wellness as a main focus related to the impact of the pandemic on frontline healthcare providers, including LPNs. The Education Standards Advisory Committee continues to monitor all approved programs' compliance with the education standards through regularly scheduled reviews and annual report submissions. All reviews conducted during 2021 were completed using a virtual platform. CLPNA's Learning Management System recorded more than 20,000 completions of the learning modules throughout the year. Topics included understanding restricted activities, immunization, administering blood and blood products, and more. Many documents representing the ongoing efforts of the CLPNA to maintain a high regulatory standard for the licensed practical nurse profession were released or updated in 2021, including 4 registrant policies, 2 information sheets, 1 interpretive document, and 3 existing documents that were redacted. In response to the ongoing COVID-19 pandemic, the CLPNA continued to provide updates through COVID-19 information sheets, providing information related to LPN practice. There were 2,343 practice consultations in 2021. These consultations varied in topic and complexity, including clarification of LPN scope of practice, regulatory expectations, standards of practice and professional responsibilities, and pandemic-related concerns from registrants, stakeholders, and the public. In 2021, CLPNA launched the Department of Performance Measurement and Research. This department continued to build its measurement system to lay out the strategic alignment through all levels of the organization. The team collaborated on several projects with CLEAR and the University of Calgary. The CLPNA also provided grant research funds to Dr. Jennifer Jackson from the University of Calgary to conduct a study on the experiences of becoming a regulated profession, a qualitative interpretive description interview study of healthcare aides. This study will take place over a 2-year period starting in early 2022. The CLPNA grew its workforce in 2021 as it onboarded 9 permanent staff as well as several temporary professionals. In addition, the CLPNA has made significant strides in its commitment towards diversity, equity, and inclusion, with the formation of an internal DEI committee in December of 2020 and the engagement of an external consultant in 2021 to support the development of DEI education for staff, leadership, and council. With safety remaining the priority, the CLPNA continued to support staff to work remotely to deliver operational services to members and the public. The CLPNA kept current and up to date on the COVID-19 pandemic, as well as related best practice and legal advice to best support and inform decisions on pandemic protocols, policies, and fostering a positive remote work culture. As a regulator, communications are critical to our operations to ensure that LPNs understand the role of the CLPNA and their registration, continuing competence, and conduct requirements as a regulated professional. It is also important that we communicate with the public regarding their safety in the healthcare system. In 2021, Care Magazine evolved to adapt to regulation changes stemming from Bill 46. Care released a new media kit and remapped the magazine to become more regulatory in focus. The fall-winter edition of Care was the last printed edition of the publication. Moving into 2022, Care will be a digital magazine. Throughout the pandemic, communicating regulatory information to CLPNA registrants and the public in digital format was more important than ever. The CLPNA continues to administer the Alberta Healthcare Aid Directory and recognizes that healthcare aides are an important part of Alberta's frontline healthcare workforce. The directory collects relevant HCA demographics, employment statistics, and the attainment of core competencies. Healthcare aides in Alberta enrolled on the directory must be maintained through an annual renewal process. Renewal was previously held from April 1st to June 30th. However, in 2021, due to the announcement of HCA regulation, the renewal was changed to September 1st through November 30th. Consequently, the usual 12-month renewal period was extended to 17 months. At the end of 2021 renewal period, 29,178 HCAs were renewed. Information regarding the CLP&A financial highlights for 2021 are included in the annual report published on the CLP&A's website. The CLP&A is a progressive regulatory body actively pursuing regulatory excellence, strengthening processes using best evidence, procedural fairness and transparency, while remaining efficient and fiscally responsible. Complete financial statements are available by contacting the CLP&A directly. The comprehensive 2021 annual report provides additional information and can be accessed online at clpna.com. Thank you.